Hi everyone, this is Becca, and today we're going to talk a little bit about schizophrenia, which is a complex and often misunderstood psychological disorder. So, we're going to look at its historical context, some symptoms, impacts in life and relationship causes, treatment, prevention, and all things. So, schizophrenia is a serious mental disorder that influences an individual's thoughts, emotions, behaviors. Those affected may appear to be disconnected from reality, causing distress not only for themselves but also for their families, their loved ones. The symptoms can hinder participation in everyday life. Might make it difficult to do basic things like hold a job and go to school and even develop relationships in general. The term schizophrenia was first coined in the early 1900s by a Swiss psychiatrist named Eugene Bleuler. I don't think I'm going to be able to pronounce his last name correctly, but it is derived from the Greek word meaning split and mind. So, historically, there were many different causes that were believed to be related to schizophrenia, as well as some really terrible treatments. And personally, I couldn't get myself to share any pictures or videos because I feel like it's really sad and really heavy and really traumatic. And I didn't want to go through that, but we are going to talk a little bit about what some of those beliefs were. So, for example, in earlier centuries, symptoms were often thought to be caused by demonic possession. So, individuals were subjected to exorcism or similar rituals in an attempt to cure them. For another circumstances, symptoms of schizophrenia were misunderstood and they often led to a misdiagnosis. The conditions were often attributed to moral fallings or spiritual issues, which would result in further mistreatment. There was also a stigma surrounding schizophrenia where those individuals were often marginalized and feared by society, leading to social isolation. Families sometimes hid their relatives to avoid shame. So it was a really difficult time where even if they wanted or needed some social support, they weren't going to be able to get it because people were so scared and they would rather shelter them away from everybody else. Once individuals were diagnosed with schizophrenia, they were often placed in large mental asylums or institutions, often for extended periods. These facilities were typically overcrowded and understaffed, leading to inadequate care. Barbaric treatments were often also used in forms of harsh or punitive treatment methods. Practices included restraint, isolation, and the use of other physical punishments. Procedures like lobotomies and electroconvulsive therapy were also used, but often without proper consent or understanding of their effects. So, according to the DSM 5, schizophrenia is characterized by a range of symptoms, which include positive symptoms and negative symptoms. So, first, I'm going to explain a little bit about what those are. So, positive symptoms of schizophrenia aren't typical in individuals without schizophrenia or other types of severe mental illnesses. So, some of these examples of positive symptoms include delusion. So, that's when that's like a strongly held false belief, like often like paranoid in nature, hallucination, so sensory experiences without any extra stimuli. So the most common is like hearing voices or seeing things. Disorganized thinking, so incoherent speech and difficulty organizing thoughts, which can manifest as a like nonsensical conversation. And agitation, like increased motor activity that can be unintentional and non-productive. For negative symptoms, those are symptoms that interrupt a person's typical emotions, behaviors, and abilities. So, some of those examples are affective flattening, so reduced emotional expression, including facial expressions, voice tone, and gestures. Another one is avolition, which is a lack of motivation or drive to engage in social or productive activities. Anhedonia, I have a hard time saying this word, is an inability to experience pleasures from like activities that are usually enjoyable, and also social withdrawal, so the decreased interest in social interactions and activities, which ends up leading to isolation. In order for you to be officially diagnosed with schizophrenia, according to the DSM-5, you need to show multiple symptoms. So at least 2 of the following symptoms, like delusion, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. So at least 2 of those are required. And there's also a duration criteria. So the symptoms must be present for at least a 6-month period with at least 1 month of active symptoms. And the functional impairment also. So the symptoms must cause significant impairment in social or occupational functioning. So they have to be disruptive to your life, to your job, to your relationships. And nowadays, the DSM-5 no longer identifies subtypes of schizophrenia, like a paranoid schizophrenia or catatonic schizophrenia. These are not considered clinically useful anymore. Schizophrenia can have a massive impact on your life and your job, your career. And on a study done in 2006 about work and schizophrenia, the research found that cognitive deficits, negative symptoms, and the stigma played a significant role in employment struggles of individuals with schizophrenia. So many individuals expressed a desire to work, but they encountered obstacles that prevented them from sustaining the employment. Another significant impact of schizophrenia is on relationships with your family, relationship with your friends, professional relationship with your significant other. So another research done in 2013 called Schizophrenia in Relationships, they found that individuals with schizophrenia often struggled with emotional expression and communication, which would lead to misunderstandings and strained relationships. And symptoms like disorganized thinking can complicate the social interactions, making it challenging for them to maintain those close ties. A great example of this in the media is the movie A Beautiful Mind. I don't know if you guys have seen it, but if you haven't, I highly recommend it. It's really, really good, and it will help you have somewhat of an idea of what a person with schizophrenia goes through, how difficult it is, but also how possible it is for you to still have a rewarding life. So it's the story of John Nash. This is a real story. He was a brilliant mathematician, but had schizophrenia, and it was very difficult because he started to have hallucinations and delusions, and he believed that he was involved in a government conspiracy. So he would go to work on this project that he believed was secret, and he truly believed of all those things. He would see people, he would talk to people, and he truly believed that was real. And that ended up creating this strain on his relationship with his wife. But then after many crises, many hospitalizations, he eventually receives treatment, and he learns to cope with the condition. And a huge part of his success is that his wife was so patient and so supportive, so much so that she was able to just stay around and help him, and he was able to learn to manage his illness, and he continued to teach, and he eventually even received a Nobel Prize in economic sciences. So this is like a real story of a person who has dealt with that and was still able to accomplish amazing work. The exact cause of schizophrenia is not clear. It's actually very much complex, and there has been so much research done trying to be able to better understand, better diagnose, and better treat schizophrenia. But it is believed to be a combination of genetics, environment, and psychological factors. Individuals with family history of schizophrenia also seem to have higher risk, as well as stressful life events and substance abuse could also trigger symptoms. So as we talk about the neurological and biological explanations, we're going to be able to understand a little bit more of some of the ideas and the researches they've done to try to better understand schizophrenia and some of the possible causes. The first one I want to talk about is the dopamine hypothesis. So this hypothesis suggests that schizophrenia is linked to dysregulation of dopamine neurotransmitters in the brain. So overactivity of dopamine in certain pathways is associated with positive symptoms, while underactivity in other areas is linked to negative symptoms. And remember, these positive and negative symptoms is what I just went over in the beginning of this video. Some studies have also shown structural brain abnormalities in individuals with schizophrenia, which includes enlarged ventricles and reduced gray matters in areas such as the prefrontal cortex and temporal lobes. So these changes can also impact cognitive function and emotional regulation. Another important factor is the genetic factor that we have already talked about a little bit, but it seems like there is a genetic predisposition that seems to play a significant role in schizophrenia. Family of and twin studies have indicated that there is a higher risk among relatives of affected individuals. Specific genes related to neurotransmitter systems, inflammation, and neurodevelopment have also been implicated. And finally, another model that I would like to share is the neurodevelopmental model. And this one is where schizophrenia is viewed through a neurodevelopmental lens, suggesting that disruptions in brain development during critical periods like prenatal exposure to infections or early childhood stress or trauma can increase vulnerability to the disorder later in life. Now I'm going to go over some of the prevalence and severity, and this to me is some really important information because regardless of what causes schizophrenia, we need to be able to understand how serious it is and how we can help, how we can be an asset to those individuals and not do the same that has been done in the past of pushing them away and excluding them from our society. In the United States, schizophrenia affects about 1% of the population. Schizophrenia affects approximately 24 million people, or 1 in 300 people worldwide. It typically emerges in the late adolescence or early adulthood, with men often experiencing an earlier onset than women. The severity of the symptoms can vary. Many individuals face lifelong challenges, including risks of other comorbidities also. It seems by some research that has been done that the use of cannabis is also associated with an elevated risk of the disorder. And finally, people with schizophrenia are 2 to 3 times more likely to die early than the general population. Now, let's talk a little bit about treatments. So some of the most common treatments for schizophrenia is antipsychotic medications. These can reduce the severity of symptoms and particularly delusions and hallucinations. Another form of treatment is psychotherapy. Cognitive behavioral therapy specifically has been shown to be very effective in helping individuals manage their symptoms and improve coping strategies. And supportive services like rehabilitation programs and social skill training can also aid in improving their daily functioning. Now, when you consider the effectiveness of treatment, it's important to consider that while antipsychotic medication can be very effective, they are not without side effects, and about 30% of patients may not respond properly to these treatments. Psychotherapy, particularly CBT that we just talked about previously, the cognitive behavioral therapy, has been shown to reduce the impact of residual symptoms and improve the quality of life. And a combination of medications and therapy is probably the most beneficial approach. The World Health Organization also emphasizes the importance of making sure that it's a recovery-oriented approach where you give people the agency in treatment decisions so that the individual with schizophrenia and their families and caregivers can be a part of it. Facilitated assisted living and supported housing and supported employment are also essential care options that should be available for people with schizophrenia. Now, here's the question. Can it be cured? So right now, schizophrenia is considered a chronic condition with no definitive cure. But as I've mentioned in the beginning, symptoms can be managed effectively, and it is possible to live a fulfilling life if you have the treatment and the support that you need. Preventing schizophrenia continues to be a challenge, especially because we don't fully understand what causes schizophrenia. But early intervention strategies can help, and programs aimed at reducing stress in at-risk individuals can also help. Early detection of symptoms and promoting healthy lifestyle choices may also help mitigate the onset of the disorder. In conclusion, I just want to say that understanding schizophrenia is so important for reducing the stigma and improving the treatment outcomes. It's up to us as a society to do better than we've done in the past, and continue doing research and continue advocating for those individuals and being a support for both the individual and their families as they navigate how to live with this really complex disorder. Thank you so much for listening to me so far, and hopefully you've learned something.